Okay.
All
So,
right.
yeah, so we're on the road to 100,000 cases in Connecticut. Just back in March, would you have seen us hitting this mark? Would you have considered this a likely outcome?
Yeah, I think if you had asked me in March, I would not have predicted the current state of the pandemic. Here in Connecticut, at least, we're in the midst of a second wave that is rapidly approaching the extent of the first wave in some metrics. So I think with public health measures, improved knowledge of transmission and treatments, I would have expected a less severe second wave. So I'm more surprised that our case count is going up as rapidly as it is right now.
What do you think we've done well over these months? What have we not done well as we deal with this pandemic?
I think specifically in Connecticut, I actually wasn't initially from Connecticut. I was from Chicago, and I moved here in July for this position. And when I came here and when I saw how Connecticut is doing, especially in the summer months, I was actually very impressed. It seemed like a lot of people here, probably based on the experience of the first wave, were taking the virus very seriously. Many were exercising appropriate public health recommendations in terms of amount of people in the indoor space, appropriate distancing. And I think as a result of that, in Connecticut, we saw a drastic reduction in cases starting in May, kind of leading through June, July, and August. That's really persisted up until now. So I've been really impressed with the state as a whole, with the citizens, the leadership. Obviously, now we're having a sort of a second wave of cases, but especially after the extent of the first wave, I'm very impressed with how the state did over the summer months.
What do you think we have not done so well? What would you attribute this latest rise in cases to, I suppose, as well?
Yeah, that's a great question. I think ultimately, I think there's a growing sense in the community of pandemic fatigue, where we're starting to see a lax in how people are handling the virus. And ultimately, we know what we need to do. We know we need a distance from others. We need to wear masks almost on a universal basis. But what we're seeing in the community, and certainly some of our hospitalizations, are from people who become lax with these guidelines and have events indoors with a lot of people that defy public health guidelines. And so a lot of that is contributing to the current wave. I think ultimately it may be hard to prevent a wave, even if public health measures are adhered to completely, only due to the fact that we're entering winter. And we know respiratory virus transmission is always more prevalent in winter months.
Can you explain a little bit more about that? I've seen a bunch of folks predicting an uptick in cases in the winter. Can you explain why that is?
Yeah, ultimately it's multifactorial. There's a lot of reasons why that could be. Primarily, it's due to everybody spending time indoors. And we know indoors, with a lack of ventilation, a lot of people are clustered together, that there's enhanced transmission. The virus is definitely more transmissible amongst others. A lot of people say humidity is a factor, where droplets that we expel from our respiratory tract aren't able to travel as far in lower humid conditions, in higher humidity conditions. And so oftentimes in the summer, we see with this virus specifically, we see some modes of transmissions through aerosol means. And what that means is that, in contrast to droplets, where kind of a big clunky particle that you expel in a sneeze or in a cough kind of falls and plummets to the floor within 6 feet, these aerosols are actually a lot smaller in diameter and can linger in the air. And they linger in the air a lot easier in the winter time, where there's just less humidity around. And so this is one of the reasons why we recommend people spend as much time as outdoors as possible. Obviously the other component to this in the winter months is behavioral, where really nobody's spending time outside, and eating outside is a challenge, and it's very difficult. So I think that's one of the primary reasons why we're seeing an uptick, is that a lot more people are just staying inside, probably more so than the fact that we're loosening, or people are being lax with public health recommendations. But ultimately this was anticipated, as is most winters with the surge in respiratory viruses. I think this winter in particular, we're a little bit wary just because this is a novel virus. We don't know a lot about it. A lot of people were even questioning, would there be a second wave? Would it be better than the first wave? Would it be worse than the first wave? It might still be a little bit too soon to tell, but we are definitely on a worrisome trajectory right now.
What have we learned about the virus over these months? What do we still need to know or have not learned that we could figure out?
Yeah. So a lot of good research has been done, and we've learned a lot about the virus. We understand a lot more now today than we did in March and in April about transmission patterns, so kind of how this transmits, and now we know a little bit better of a distinction between droplet and aerosol transmission. We also understand a lot more about treatments. So previously in March and April, we really didn't have anything. We were trying a lot of therapies that worked in the laboratory setting, but really did not pan out in the clinical setting. Notably, hydroxychloroquine is one of the main therapies. Now we know we have a number of treatments that appear to be effective in randomized controlled trials. So one of them being remdesivir, which is an antiviral, another being steroids, which blunts the immune response to a subset of patients who have severe illness, who require oxygen. And so we do give that to patients who are hospitalized on oxygen. And we've shown substantial mortality reduction, which is very good news. We also know that there's monoclonal antibodies coming through the pipeline, which appear to be promising. And certainly ICU care has changed. So less people are on ventilators, which is a good sign. And we are proning patients, so we're putting them on their front so we can have the back of the lungs expand, which helps oxygenation. And then most excitingly, as I'm sure many people have heard, there's been 2 vaccines that have released press results from their preliminary studies, which all look very promising. So one by Pfizer and then one by Moderna, which pretty much use the same modality, which is the mRNA technology. And both of them show upwards of 90% effectiveness in their phase 3 trials. So this is all very exciting. And I think ultimately the vaccine will be the primary driver behind why this pandemic would end. But I think we're many months away from that right now.
Are there things you'd still want to know about this virus? Any major outstanding questions that you see?
Yeah, that's a great question. We continue to learn more every day, I would say. And the scientific community is almost like a race in publications where every day there's something new that comes out. Just last week, in addition to the vaccine knowledge, historically, what we knew was that masks protect the sick wearer of the mask from expelling infectious particles to others. And really the utility of wearing a mask for those other people was a lot less. And it was more the mask was to protect the sick person from transmitting it out. And we now have data that shows the mask also protect the healthy person who's wearing it from viral particles coming in. So the CDC actually revised their recommendations last week saying masks are helpful from both sides. When previously we thought the majority of help was really to prevent the sick person from transmitting it outward. So we're learning a lot more about transmission patterns. And I think over time, there's a lot of people interested in treatments. And so we continue to test antivirals and other treatments that may really help mortality in these patients. We're learning a lot more about immunomodulatory therapies, and there's been a lot of excitement previously about a drug called tocilizumab, which blunts the immune response. And so we're learning a lot more about that. We're learning a lot more about monoclonal antibodies, convalescent plasma, that we really didn't know early in March and April. And so I think in the coming months ahead, we'll continue to learn more about this.
How are things going at Yale New Haven during this rise in cases? Have you made any changes in how you typically do things for a coronavirus patient during this period or in recent weeks?
Ultimately the change, Yale New Haven we're doing well. We, like other hospitals in Connecticut, are seeing an uptick that really pretty much mimics what we're seeing in the community. So our curve continues to go up as well in terms of admitted patients and hospitalized patients right now. The big difference we've seen is that anecdotally, we're requiring less ICU patients who need ventilators. And so a lot of that is due to the effective treatments we've had. And we do have some patients who receive remdesivir and steroids if they do require oxygen. So the mortality rates, which has actually been shown nationwide, are going down. And we see that here at Yale New Haven as well. We are not currently at the levels that we were at in the spring, where we had a greater surge of hospitalizations. And so we are much less than that right now. However, I will say the trend is worrisome, where we're continuing to go up, which again is mimicking the community. So, and it's a little bit unclear when we'll hit that peak. So we are making all necessary plans and precautions to brace for a further surge in patients, and we do feel prepared.
What advice would you give folks as they consider the holidays upcoming and, you know, the traditional winter gatherings and celebrations?
Yeah, I think the best advice I can give is ultimately to celebrate the holiday with the people you already live with. This is really the best way to reduce the risk of getting the virus. The more people who gather at the holiday table, the more chance there is of a transmission of the virus to one of your family members. So I would exercise caution. I would say if people are engaging in holiday festivities with family, to continue to adhere to public health recommendations, which would be, whenever possible, maintain greater than 6 feet of distance, wearing a mask, eating separately, and really limiting the amount of people in the gathering itself.
And just what advice would you give to folks who are struggling with this, just having to continue to deal with this in their day-to-day lives?
Yeah,
I think it's having a mental health impact for a lot of folks.
It's caused a huge mental health impact, and it's sort of one of the burdens of this pandemic, where, you know, not only are we seeing this devastating virus cause problems from an infectious standpoint, we're seeing a lot of issues with other illnesses as well. We're seeing people neglect their own mental health. We're seeing people neglect other illnesses they may have, whether that be heart failure or diabetes or something else, where they're not seeking medical care, really out of a fear for the virus. And, you know, the only things I want to say is that I would say, firstly, you know, now is definitely not the time to get lax and loosen precautions and really stop adhering to public health measures, especially since we're entering the winter and we're anticipating a difficult few months ahead. The other thing I want to say is that, you know, there will be an end to this pandemic. There was an end to all the other pandemics, including the 1918 one, which this most commonly gets compared to. And so there is an end. And I think with increasing treatments that are coming out that appear to be effective, with vaccines that appear to be very effective, the end is in sight. I don't think it'll be tomorrow or next week, but I think in the months ahead, the year ahead, we should see an end to this pandemic. I think this is going to be a challenging and for many very odd holiday season, where a lot of us may end up being distanced, but I do believe that this will only be a one-year thing. And I think by this time next year, we should have a much greater sense of normalcy.
And what lessons do you think we should collectively take away from this period? What lessons will you take away?
That's a great question. This has been it's been a very challenging experience for myself and I know many of us. And I think the biggest lesson I've learned is the power of coming together as a community to fight something like this, which almost seems like an unknown villain you can't see, but is sort of just lurking in our own community. And it's really hard to know who has what. But you know, I've really been impressed with the way the community here in Connecticut's come together. And I think that's given me a lot of hope and optimism for the future. And the other thing this has taught me from a medical perspective is that we really need to rely on our scientific guidance. A lot of interventions being done early in the pandemic weren't really evidence-based and have not panned out. And so I think now that we've allowed science to catch up in terms of randomized trials, following guidelines, we've shown that there are effective treatments we've developed, including steroids. So at least for me, those have been two very big lessons.
Well, thank you. Those are the questions I have off the top of my head. Anything else you'd like to say? Anything you think folks should know that you haven't touched on here?
The only thing I would say is that the next few months ahead will be rough. It's tough to know right now if it's going to be worse than March, April, but our current trajectory is not good. And I do think this will be probably the most challenging months of the pandemic, the immediate ones ahead. And I do think after that, things will continue to improve once things are already improving from a scientific standpoint, where we're finding treatments and effective solutions to this pandemic. And I really hope this is the only large pandemic like this in our lifetime. You know, it's certainly the first in 100 years. So I have no reason to think there will be a second one soon, but obviously, we've learned a lot, and I think it's taught us a lot about our public health infrastructure and sort of how we handle pandemics as a community. But
Thank you so much. I really appreciate your time with this. Thank you, sir.
yeah, thanks, Ben. Anything you need in the future, just please reach out, let me know, and I'll be happy to touch base.
Will do. Thank you.
All right.